Welcome. I'm Dr. Michael Pryor, and today we want to talk about utilizing the problem list in the electronic health records. There's going to be 6 sections to this, and they're all recorded separately, so it'll all be relatively small video files, about 10 minutes long each. But the first section, we want to look at the big picture, the overview of electronic health records. It'll give you a better understanding of the context of where we're going with this. In the second section, we're going to look at a definition of what is the problem list and also what belongs in the problem list. In the third section, we're going to look at how the problem list functions within the electronic health record. In the fourth section, we're going to look at the smart cloud process and how that is going to change based upon how we're utilizing the problem list. In the fifth section, we're going to look at how we're going to transition our existing patients to this new process. And in the sixth section, we want to look at how we're going to be measuring the change. So what our quality assurance team is going to look at to measure this change, and also gives you a chance to look at retrospectively how this is going to be measured in your records. In order to better understand why we're utilizing the Smart Cloud EHR as we are, I think it's important to view the future view or vision where EHR is going. In the past, back in the 80s when I first graduated, your documentation was pretty much only seen by you. Rarely was it ever requested by even an insurance carrier in those days. As time progressed, more and more third-party pay insurers would request your records in order to verify the services you provided. But if you look at EHR in the Center for Medicare and Medicaid Services vision of that, the record is no longer just yours as the doctor. It's going to be viewed and added to by several different parties. Primary care physicians will have access. Any specialist the patient sees will have access as well. All the hospitals, so any hospital your patient goes to, whether for an overnight visit or emergency department visit. Patients, so then that's current now, so part of meaningful use allows patients to have access to view their records. Third-party insurers, of course, will be able to view the records. And then secondary uses. So secondary uses would be NIH, government agency that is interested in either clinical research, population health, meaning that if there's an outbreak of, say, the Zika virus in a certain area, in real time they'll know where that is and how to manage that, and even quality and safety improvements for patients. So I think we need to start talking first about the big picture of the patient-oriented health record. And this was actually developed back in 1968 by Dr. Lawrence Weed. At that time, I think he referred to it more of the problem-oriented medical record, because back in those days, healthcare was not as inclusive as it is today. But just about every EHR system that I've seen utilizes this problem-oriented health record. Let's look at a brief clip from Dr. Weed actually addressing the Emory Medical College in 1971.
And then the record study becomes an unbelievably important document in education, in research. But as long as we were a profession that thought we could let something in, and it was what you know makes a difference instead of what you do. And as long as we thought of documents as oracles and no answers instead of guidance in uncertain situations, we were willing to let the record of American medicine fall to this level. And now when the computer people move in, and the Medicare people move in, and the non-medical people move in, they can hardly believe what they do. And there is a question.
I think it's interesting that even back in 1971, he had the foresight to see what might be happening with Medicare and insurers and big business coming in and taking over healthcare. Anyway, the problem-oriented health record has 4 parts to it. So the database, and we're going to talk about that more in the next slide, but it also has a complete problem list, and that's going to be the majority of what we're talking about the rest of today. Patient care plan, which you know that we have in our records currently, and progress notes in a SOAP format, which again, I think we're currently doing that as well. So if we look at the database, by the database we mean the comprehensive history. And on your EHR tab, you'll see that you have all of these history categories here. So from family history to allergies, review of systems, medication history, family history, social history, hospitalizations, all of that, that's the database. And that is going to be accessible from clicking on any of these categories in the tab on the left here. Many people think of electronic health records as just a storage house of all PDF versions of all the visits they've ever had. But that's not true. Mostly it's going to be more interactive, where you can access most of the patient's record and current updated information from the tabs. This could also include their x-rays and test results and any other additional information added to the database, which would include things that are scanned into the record.